Hi, I'm Dr. Artis, and I'm going to be talking to you today about exactly what blood pressure is in this module. We're going to talk about allopathic medicine treats blood pressure, and we're going to take a deep dive into it. So come on and join me for this journey. Now, one of the things we talk about blood pressure because it is known as the silent killer. It is also called hypertension. Some people also say, man, you got high blood pressure, you got that pressure. High blood pressure is deadly because it can actually increase your chance of having heart disease. It actually increases your chances of going on dialysis, having a stroke, having a heart attack. It's so many things that can happen when your blood pressure remains high and uncontrolled. So that's why we're going to talk about how to take care of it today and what we need to do to watch out for. So we're looking at this right here. We got roughly, a research study I read said that we got roughly about 1,100 people dying a day just from high blood pressure. It's been a 38% increase in the last 10 years of how many people are dying from blood pressure. It costs us billions of dollars, not millions, but we got millions of people dying from it. And it's something that if you pay attention to and get a hold of it early, you can manage it naturally. And that's what I want to share with you, some natural tips to do it. But before we jump into that module, we're going to talk about how the allopathic medicines or regular doctors take care of it. When you're looking at the blood pressure, you very understand that everything in the body is controlled by the nervous system. People say, well, how does nervous system deal with the blood pressure? Well, the simple fact is that the nervous system controls every single function in your body. It controls the way your heart beats. It controls the way that your blood vessels contract and relax. And so the nervous system, the way it works is the brain controls everything. And it does so by sending energy down the spine to all the nerves in the body, to all the organs, cells, blood vessels, tissues, and everything in the body is totally dependent on that energy that's coming from the nervous system. Wow, that's pretty powerful. So that nervous system is broken down into two different processes. It's broken down into a parasympathetic nervous system and a sympathetic nervous system. Parasympathetic nervous system is where we want to spend some time. That's where our body is resting, repairing, digesting, it's healing. That's why when you get sick, you go into that parasympathetic state. You go and you take a nap, you lay down, you rest, and you let your body repair and heal itself. Now, the sympathetic dominant state is when stress is introduced into your body, and that can actually that's when you go into that fight or flight. When your body perceives some kind of negative impact or some kind of stress, that means your blood pressure is going to go up. And not all stresses are bad. A good stress will be exercising. Your blood pressure could go up. Having sex is another one. But also the problem is when we got to pay this bill or when we're worried about money, that's a sympathetic stress that actually causes our blood pressure to raise. It causes us to be overstimulated. When the nervous system is overstimulated, it's hard for the body to repair and rest and to digest and to multiply, and it's hard to regulate the blood pressure. Two very important concepts. So one of the things that I've noticed with a lot of people is that they stay in a sympathetic dominant state. Got to do this, got to do that, got to do this. We have to learn how to relax, and that will help to balance your blood pressure as well. But you understand this concept, then you understand too that the heart is controlled by that nervous system. And if it's overstimulated, it can cause the heart to speed up, slow down. It can do so many different things. But the heart is the muscle about the size of my fist. It sits slightly to the left side of my chest, and it pumps blood throughout all the parts of my body, to my brain, to my legs, to my hands, to my feet. And so what happens in that point, the most common thing that causes high blood pressure is left ventricular hypertrophy. Let's say it, left ventricular hypertrophy. That's where the left ventricle of the heart, which has 4 chambers, is actually, the left ventricle is the strongest, that pumps the most blood throughout the rest of the body. It actually works overtime. Okay? And when it works overtime, it leads to 2 different types of high blood pressure. One could be ischemic. Ischemic high blood pressure is when the body is not getting enough blood. The heart is not getting enough blood, and that's usually due to some kind of blockages. That's when you go to people that go and they have bypasses, or they go in and they put stents in to open up the heart because of the blockages. Ischemic high blood pressure, that is very severe. Also, you got hypertensive blood pressure. Hypertensive blood pressure is usually the most common. That's where the heart is enlarged, which eventually leads to congestive heart failure. That's where you'll start to see the swelling in the ankles. You're starting to see the swelling in the extremities, the hands, and so forth. And then that right there causes fluid on the lungs, and that could just be a snowball effect of a lot of other things that can happen because of that. Okay? The way that when you go to the doctor, you have high blood pressure, that allopathic medicine or regular doctors treat it is usually treated in 3 different ways or 3 different types of medications. Sometimes you can have people on 2 different ones. Sometimes you can have them on one. Sometimes you can have them on more. It just depends on what they're trying to accomplish or what factors you got that actually is causing your blood pressure to raise, okay? So we're going to talk about the three most common ones that doctors use. And the number one is called a diuretic. Diuretic is also known as a water pill. A water pill is a way of managing high blood pressure that actually gets rid of excess salt and excess water on the body that decreases the amount of swelling like we talked about in the hypertensive part of high blood pressure, okay? So when you look at this right here, the problem with that is, and one of the side effects that I've seen is it tends to actually excrete too many minerals and vitamins that the body needs, like potassium. And for one, that can cause muscle cramps. It can cause people to feel tired. It just causes a lot of different things. The most common one I've seen is cramps. And so what happens is I've seen people come in my office and they're complaining about cramps or they're complaining about muscle aches, and it could be a side effect of the medication due to them taking a water pill, okay? The second one is that we have beta blockers. Beta blockers is a common one that doctors use. What it's usually do is it's used to reduce the heart rate, okay? And it reduces the workload on the heart and the output. The problem with that we see with some of those side effects is insomnia, okay? People having trouble sleeping. Some people have cold hands and cold feet because the output of the heart is dropped. So therefore the circulation is not there and they tend to get cold hands and cold feet. Another one is tiredness or depression. I've seen people with side effects of those things where they feel tired and sluggish just all the time. They might feel depressed or not feeling like themselves. And then also too with men, that's one of the main causes of impotency. When you have decreased output, blood doesn't flow to those sexual organs, so therefore they don't work. Also with asthma symptoms, you might have known someone or know someone that recently developed asthma as a result of being put on a medication. I challenge you to, whenever you're taking any kind of medication, to actually go back and sit down and look at the side effects on it. I'm not telling you not to take your medication by disclaimer. You got to follow up with your doctor. I'm just educating you on different things that you need to know about these things, okay, before we take them. So that's a beta blocker. And then the third one that I got to mention is the ACE inhibitors. That's what that does is that ACE inhibitors, they actually help the blood vessels to relax. So one of the problems with maintaining a normal blood pressure is the blood vessels of some people, they have a hard time relaxing and contracting. So they kind of stay stagnant because as we get older, and sometimes due to different diets and stuff and that workload that we put on our bodies, we lose the elasticity in the blood vessels so they don't contract and regulate and relax like they should. So the blood pressure, we have a hard time regulating our blood pressure. That's where the ACE inhibitors would come into play. Now, what are the problems that I've seen with those is it can cause skin rashes. It can cause loss of taste, which also creates another problem because it leads people to tend to put more salt on their food. Also, it can cause a cough. You've probably known someone or know someone, again, that maybe developed a cough out of nowhere. And it might be a side effect of a medication. It may be a side effect of an ACE inhibitor. So that's something to look into. And one of the most important side effects that I warn you about is that ACE inhibitors are also known to actually cause kidney damage, which could open up a whole new can of worms and lead you to going down the road of possible dialysis. Regardless of that, that's the way that they treat it. Diuretics, beta blockers, and ACE inhibitors. And if uncontrolled, high blood pressure can lead to a heart attack or a stroke. So you want to make sure that you're managing these things before you stop taking any medication, because you got to talk to your doctor about that, because that is a whole nother problem. You don't want a stroke. You don't want a heart attack. And if you could do something to help prevent it, the thing you would do is take those medications unless you learn natural ways to manage your blood pressure and work in conjunction with your doctor. So we're going to dive into those natural ways in the next module.